Hi, good morning. It is Monday, March 1st, and I'm in my classroom. I'm getting ready to do the morning announcements today. So we've been doing announcements for Black History Month, and today's my day. Also, we're going to do more vital signs today. We're going to talk about blood pressure and respirations, and so I've just been in here checking my emails and working on my training class that I'm getting ready to do also, and I'll talk to you guys about that a little bit later. Bye. All right, so this is my planner for my schedule for this week, March 1st through the 5th. Today is Tuesday. We had a faculty meeting this morning, and my health science guys, they are going to do a lab with counting their respirations and learning how to do blood pressure today. And then my rehab class, they're doing modalities, so they'll be learning different equipment to use for rehab patients, like cryotherapy, heat and cold therapy. And then today's my short day, so I have planning and have a meeting during planning. And then my CCMA class, my clinicals, they're going to have a quiz on the order of draw. And we're going to do some more review on phlebotomy. So March the 2nd is today, and I wanted to show you a little bit of my calendar. So I am going to give some papers back today because we are going to do some review. And this week, I updated last week's assignment. So guys in class, I want you to write these terms. For my guys that are online, can everybody see the Teams page? You guys can't see it, but it says we will continue with vitals this week. We discussed taking your pulse on Friday. The checkoff sheet that we did is the radial pulse checkoff, but we're going to continue using that checkoff sheet to fill in our chart, okay? So we're going to continue to use this to fill our chart out. And then the radial pulse is this way. Guys at home, did you get to practice doing your radial pulse? If not, I hope that you will practice. I want you to practice taking your pulse on someone else to get practice, but if you don't have anyone, then you can try and take your own pulse with your 2 fingers, not with your thumb, okay? So you will fill out the form as we move forward with vitals. So this form here, I think everybody can see, is the one we're going to use. So it has our date, our time, blood pressure, temperature, pulse, and respirations on it. Okay, so this is what we are using to fill that out. And if you can't print it out or write on it, then just write it on notebook paper, okay? So on Friday we did the pulse. Today we will try to work on blood pressure. I know that the distance learners don't have equipment at home, but I'll show you how to do it. Therefore you will record the time, the date, the time in military time, the pulse, and the respiratory rate. So for distance learners, that's what you will record, what is in green on Teams here. You will need to count another person's respirations. You won't be able to count your own. However, if you have any of these supplies at home, you can add the activity to the flow chart. So if you have if your parents are in the medical field and you have like a pulse oximeter or a stethoscope or a blood pressure cuff, then you could work on those things also. But if you do not have them, you're only recording what's in green. For the signature part, so there's a signature part on here. And guys in class, I'm sure you've seen that too. So when you guys finish writing these terms, I want you to get this sheet out, the one that y'all worked on last week with your partners. So you are writing your name in cursive if you know how to write it in cursive. And then after you write your name, so if I wrote Dr. Jones, comma, RRT, that's what I would write. But you are going to write your name, comma, HSST for health science student. Okay, we're going to review vital sign PowerPoint today because in here you see we will review the VS review worksheet so you can study for the test that will be on Friday. Okay, even though we're taking a test on Friday, it's going to go on the 4th 9 weeks. Okay. All right, so let me stop sharing for a second. Does anyone have questions? Are you done writing? All right, raise your hand if you're done writing the terms. All righty. So I have a few people still writing. That's why so the vital sign worksheets you guys have, I'm going to try to go over those. And it's this sheet here, so I'm going to give these back. But we're going to go over them. So hopefully we have all of our information on here. All right, so for our bell work today, guys, if you're not done, take a picture so that you can copy the rest of the words. So guys, on Zoom, try to name the 4 main vital signs and then email them to me. Okay, we're going to give you guys like 5. All right, so if you did not get a note card, it's because I do not have your name and I don't know whose paper it is. What are the 3 things we need to note about pulse? Daniel, give me one. Rate, okay, so it's telling us how fast. Logan, give me another one. Volumes, telling us how strong or weak. And Jakari, give me the last one. What'd you say? Rhythm, regular or irregular. All right, so 7 pulse sites. We've talked about them. They're the temporal. Where's the temporal? At the side of the head. Okay. So a lot of times the people will take your temperature here on your forehead, but your pulse you can feel on your sides, your temporal or your temple. Your carotid in the neck. Brachial, the inner aspect of the forearm, also called the antecubital space. So if you hear antecubital space, it's this inside where your elbow is, okay, that little bend there. And then radial, our thumb side of the wrist, of the arm at the wrist. You guys remember these? All right. What is up with the keyboard? I don't know what's going on. It won't let me change. This is brand new projector. What's happening? All right, then we have femoral, the inner aspect of the upper thigh or the groin area. Okay. What else do we have? Are we missing anything? Which one? The foot. Okay, has a weird name. So we have the popliteal behind the knee, the dorsalis pedis or pedis at the top of the foot. So if you go get a physical and you see that the doctors feel it on the top of your foot, they're feeling the dorsalis pedis. More, which was the posterior tibial, that was on behind the foot or on the ankle side of the foot. 60 to 100, to 1 year and under, 115 to 130. And on the board, I put normal ranges for male and female. Okay, so I want you guys to learn this information. But bradycardia means slow heart rate, less than 60, right? Tachycardia, fast heart rate greater than 100. And then arrhythmia is abnormal heart rate. Do we remember these? Okay. Alrighty, we're going to see. What causes changes in our pulse? Does anyone remember? Madeline. Exercise. Okay, Ashley. Stimulation. What else do we have? Ziona? Stress. Okay. Thank you. So exercise, illness, infection, anxiety. What decreases our pulse? Nardine, what can decrease our pulse? Sleep, okay. Caitlin? Depressants, okay. Alexa? A coma? Okay, I thought she said homework. And then Logan. They did. Do you know another one? You know another one? So if you work out a whole lot, high level of aerobic fitness. Most athletes, I think I told you guys once before, who like run every day, are very athletic, you know, like football players, basketball players, running track, they have a lower pulse than normal people. Well, not normal people, but than the average person. So depression, sleep, these are some things that affect the change in your pulse. I don't know why this is just not clicking. All right, so your apical pulse. What can you guys tell me about your apical pulse? And if you guys have your notes, I mean, you can look at your stuff. Yes, Ashley. Okay, so you take it with the stethoscope and you auscultate the pulse. So when I say auscultate, what am I telling you? You're going to listen, okay? So apical pulse, taken with the stethoscope. It's the actual heartbeat. All right, and where did I say it is on your heart? The lower point on what side, right or left? The left. So that was pointing to the left, okay? All right, because children and infants usually have a high heart rate, the apical pulse is used often to count their pulse. 2 beats are heard like a lub-dub sound. Each lub-dub you hear is 1 heartbeat. Okay, you guys remembering? Trying to refresh your memory here. So remember, on here has an example of a pulse. It says 72 beats per minute. When I told you to write it out, remember I said put P for pulse. 72, whether it was regular and strong. Everybody remember that? Y'all write that down? Okay, so I want you to remember how you would write that. So pulse, P, 72, regular, strong. All right, so for respirations, the process of taking in oxygen and expelling carbon dioxide. So remember I said 1 breath is in, you inhale, then you exhale. So 1 breath, inhale, then exhale. That's 1 breath. All right, so the adult average for respirations is 12 to 20 per minute, okay? The average infant is 40, sometimes a little bit higher depending on the age of the infant. So you always want to note the character and rhythm of your respirations, just like your pulse, okay? All right, so the character refers to the depth and quality of respirations. So is it a deep respiration? Are they taking really deep breath? Are they shallow? Are they barely breathing? Is it labored? Are they looking like they're about to pass out? They're panting like a dog? Is it look like difficult breathing? These are all characters of what it would look like. Then the rhythm. This is the time between each breath. So is it regular or irregular? Dyspnea is difficult or labored breathing. Apnea is the absence of respirations, because remember, A means without. Tachypnea is fast rate above 25. So if we said normal is what? What's a normal for adults? (12 to 20). Thank you, Ashley. So anything above that 20 for adult or for you guys is going to be tachypnea. Fast rate, fast breathing. And then we have bradypnea, slow rate, usually under 10. And some people may say tachypnea or bradypnea, but we know what we're saying, right? So if we have rales, which are bubbling or noisy sound caused by fluid in the lungs. Wheezing is the high-pitched whistling sound on expiration. And if anyone has asthma, a lot of times this is what you hear from an asthmatic, the wheezing sound. And it's like a whistling sound. All right, causes of changes in respirations. So for increased respiration, you have exercise increases it, anxiety and pain. Decrease in respiration, we have relaxation and depression. So just like increase in heart rate. If you have a head injury, your respirations can go down because your body, if it's a traumatic brain injury or concussion, or like a severe concussion, which is a traumatic brain injury, then your brain is not telling your body what to do, so you may slow down because you don't have a lot of activity going on in your brain. So we're going to stop here on cyanosis because we're going to do our activity with our respirations, and then tomorrow we'll just pick back up with blood pressure, unless we do it in our DI. I cannot talk today. Our C and I time. All right, so guys in class, I want you to get up and move closer to your partner. If your partner is not here, then let's see, whose partner is not here? I know Brooks. Okay, so then I'll be your partner because my partner isn't here either. Okay, so I want you guys to move closer to your partner. I got one person moving. Alexa, we turn the light on, please. Okay, so guys at home, we're going to stop here. Okay, so on your worksheet, we've already done the pulse. We're going to do respirations today. Now remember, when we do respirations, Brooke, how did I say you count it? What? When they breathe in and out, that's how many breaths? 1. And I want you guys to do like you did with the pulse. You're going to count it for 60 seconds. Okay? Got it? Alrighty. Now, raise your hand if you're confused on what I'm saying. All right, so guys at home, do you understand what I'm saying for respirations? Emma, do you understand? Okay. So we're going to practice that, and then since you're at home, if you want, because you have just a little bit more time, you can practice pulse and respiration today, okay? And then we're going to put it in this column here. Alrighty. Y'all ready? Why are y'all looking at me? Y'all got the watches, right? Y'all ready? No. Are y'all doing it? I just said, who didn't have a partner? Okay. Oh, you weren't here. Your partner's still not here, so you work with Brooke today. All right, and if you want to wear gloves, you can get some gloves, but we're not touching, we're just watching, okay?
Yeah, I didn't do that.
Okay, so remember I said, let's do it this way. Remember I said, I guess we will need some gloves so that you can pretend like you're checking the pulse, but you're actually doing the breathing.
So you're watching him breathe.
Yes. Yes. Yeah, you know, and when you get used to doing it, then you can do it like you're listening to their breath sounds with the stethoscope. You can hold the stethoscope on them a little bit longer and listen to their breathing. If you're checking their pulse manually, you can get the pulse and then you can count the respirations. So you have to do it where the patient doesn't know that you're doing it. So even though this is our activity today, try not to breathe abnormally while they're trying to count it, okay? So we're going to try to do this for 3 times, and then you're going to switch, okay? All right, so let's start. Well, I talk to the guys at home. Ooh, my son's growling. My goodness. It is weird until you put it all together, but you have to learn each step and learn, you know, how you're supposed to do it first. It'll get better. It won't be so weird. All right, let's see. Okay, hold on, Aubrey. Daniel and Jakar, what are y'all doing? You what? What? You trying to set the timer? It doesn't matter. All right, let's make sure I got the right one. Okay, so if you can't see, like y'all couldn't see your chest? Okay, tell her to turn her back to you and breathe. So y'all turn your backs to each other and see if you can do it that way. If not, then you'll have to get some gloves and then just kind of lay your hand on her back. Breaths per minute. So it's BPM, but it's breaths. All right, so make sure you introduce yourself and you tell me what you're getting ready to do. You're getting ready to do my vitals, right? So tell me your name. Okay, and what are you here to do? All right, and you asked me my name. All right, Dr. Jones. And then I have a wristband on, which we're pretending. And you're gonna ask me my birthday. You check the wristband, you ask me my name, I gave you my name. And then you check my band to make sure, see what my birthday is, and ask me my birthday. All right, so then I tell you blah, 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 and you know you have your right patient. Okay, so now you're gonna do my pulse. Okay, so you have your timer. You can put your timer on my leg. Kind of hold it. How long are you doing it? For a minute, okay? So you're gonna check my pulse. So where are you checking the pulse? Okay, can you feel anything? Okay, so get your timer for your minute. That's why you have to have a watch. Stop it. What do you think you got? All right. Okay, hold on a second. What are y'all confused about? The blood pressure? Okay, so she just did my pulse, so she's going to do my blood pressure so everybody can watch, okay? So she's writing down documenting my pulse. All right, so get the blood pressure cuff and stethoscope. So guys, listen, when you are working in the hospital, most likely you're gonna have to pull your hair up, pull it back so that it's not getting in your patient's face, okay? But I know right now we're, doing teaching purposes in school. So, do you have something pulled back there? Oh, she's prepared over here. All right, so put the stethoscope around your neck. And then get the blood pressure cuff so that you can wrap it on my arm. All right. So we already have all of our stuff together. And remember I said you have to make sure you have the correct size. So if it's falling off of your patient, they may need a smaller size. But for the ones that we have, I want you to try to put it on a little snug. Okay, so that it doesn't start turning around on you. All right. So turn like sideways so they can see a little bit. All right, so everybody looking? So this is the side she's going to put on my arm. So I put my arm out. And where the gauge is, it has that arrow for artery. We're putting that where the bend of our arm is, right? Okay, so let that go. Now wrap it around my arm. And you always tell your patient what you're doing, making sure, you just let them know I'm gonna reach under your arm so that they don't get kind of weird on you. All right, so I'm gonna lay my arm down a little. So it's not moving too much, so she has to pump it up because you're not gonna put it on extremely tight. All right, if you can't see, I'll move over here if you want to see. All right, so she tapped on it to see if she could hear. Go to the side. She's gonna put it under the cup. Hold it with your other hand, your thumb. Use your thumb. Wrap your hand around. There you go. Like to stabilize my elbow. All right, so she's gonna close it off so that she can pump up the cuff. Is it closed? All right, so you're gonna pump it up to about 140 on me. 140 to 160. All right, so pump it up kind of fast. All right, go up a little bit more. All right, so now she's going to slowly release. All right, and then you start hearing the first sound, which is the systolic pressure. And then she lets it go a little bit more. You keep hearing like the pulse sound, and then another swishing sound at the very end, and that is our diastolic. And once you get that, then you open it all the way up so that your patient's arm can breathe, your blood can start going back down. Okay, so did you guys see that or hear me? Because I don't know if you can see, you were kind of over there.
Yes.
All right, so now what is the question you guys have?
Well, my question was, like, how do you know that you feel the pushing sounds? Because, like, whenever I had to do it,
Okay, so sometimes if you can't hear, you just have to continue to practice to kind of train your ear to listen for the sound. So did you hear anything? You hear anything? Okay. When you tapped on the stethoscope, could you hear that? Okay, so put them in your ear and tap on it to see if you can hear that. It's going to take practice for us to be able to get it. Okay, so you can. So the sound is on. It's working. So you're gonna make sure you put it under the cup. Okay, right here where the artery is, so that you can hear. Okay. All right. So let's try it again. So this time, I want to see if you can hear something. And like Madeline, you may need to take your jacket off. It may be too thick for her to hear, but hers should be okay for you to hear. And if you can't, then maybe the clothing is just thick. All right, can you put it back on, please? And then we'll see if you can hear it. Okay, so where's your gauge? On the side. Here it's supposed to be. Is that where it's supposed to be? No. Let's see right here. Okay.
and then
There you go.
yes, that hurt. This side hurts.
Did you hear something the first time? Here, try one more time. So, move your stethoscope over, make sure it's flat. Make sure the bell is flat.
Miss Jones,
you're supposed to use the big side, the larger side.
But that just does not make sense. Use the big side.
So now we did that part. So what we really want you to do, guys, you're not going to get the reading exactly, but I want you to get the steps. All right, put them up in it, then I want you to do my respiration. And remember how long you're going to count those?
Yes.
Okay. All right, so I'll just breathe. I'll try to exaggerate a little bit so you can see. All right, so we'll stop there.